take some deep breaths and trust it if you can. If you want to hold a part of the sheet, I'll let you. Now remember I said you never want to cross over because you start hurting the back when you cross over and do stuff. So if you will just look at the head of your client, you know this is the hand that you're going to pick the leg up with. So I'm going to pick it up here, right below the knee. I'm going to come and I'm going to pull this drape up. Can you see now how it's pulled here, pulled here? If you would like to hold this, if you feel more comfortable, you can. Now I want to get the drape a little bit higher. If I kind of, I need to get this a little higher, then she's going to feel like a little tickly thing going on and be like totally, whoop, tighten right up and not be comfortable. So I pull on it for security and just twist it up once and then bring it on into here. I got you covered here. Okay, so we always, what do we do when we get to an area that we're going to work? We say hello to that whole area. So I'm here. I don't want to just put cold lotion on her and start rubbing. She feels an immediate contact. Step through the waterfall, intent is everything, and then you're going to be ready to work. Should have done that before I draped her. So now I'm just going to start in. And remember, and you'll see now why it's very important that you wash your elbows all the way up to your elbows. Start in, effleurage. I'm in the bow stance, and I just lean forward and come back and lean forward. So I've done about 4 good effleurages. Now proximal coming up by her body. I'm going to start off with the petrissage. And here you want to pick up. This isn't just picking up. I'm going, okay, I've got the vastus medialis, you'll learn all of these muscles and you start feeling the ACLs, right? You start feeling what's happening. This one needs it a little bit more. I don't have to always grab that side. I can come in here and go, this muscle is really tight. A wonderful thing to do, you can absolutely make it a habit. When I'm going to come a little higher on someone, I hold this drape. It's a tool to me. And they don't ever feel like that I'm coming too high because they know that drape's there. New Mexico law, it's against the law for me to go under the sheet, so they can trust that. So I'm petrissaging in here, finding these different muscles, what's happening with them. And then I can come in here, and they say don't petrissage, but as the NMSU instructor said, compression. Can you see how I'm doing some compression? This is kind of, to me, you combine strokes. It's kind of like a compression effleurage. So I'm combining this in here, and then I'm coming over to this side, and I'm going to do some loose fist ironing, and then I'm going to take my palm or fingertips, and I'm going to go around this trochanter and start loosening it up. And then I'm going to loose fist iron this, loose fist. And if you don't like loose fist, personally, if I come off of the gastrocnemius, I hit the 2 largest muscles I need to. And a lot of times I will just hook in here. My fingers are my antennas finding stuff. My palms are following behind those areas so that I can come in and make sure that I have that. So I've petrissaged, loose fist ironed, gotten the trochanter. The attachment is right here. And just like on there it said do the glutes and then the legs, you never want to let a client know. I mean, what's the difference? You never want to let a client know that you started with the leg instead of the glutes. So I will go into that glute in just a minute. Way to go, huh? All right, so.
Sometimes I start with the glutes, leg, then come back to this glute because I forget to go.
You know, you just go with this. So I've petrissaged. I'm gonna leave this area with the wave. And I'm gonna come down. And remember, the wave is not back and forth sawing. The wave is picking. And do you see how the body gets into this? They will feel if you're doing this and way overworking your shoulders and neck, or whether you're involved in the entire process. And then I'm going to effleurage what I worked on out of there. If something was real tight, I may just loose fist iron it a little, come down into here, and then now I'm going to work the gastrocnemius, the soleus, I'm going to work the calf of the leg. You'll learn the names of all these muscles in time. So, fingertip frictioning the sides, and you want to, right in here, you're going to feel along that bone where you had to learn to go in the little valley, you're going to feel right in here this little valley. It's important to get that. All of these are connectors to the knee. So as you're in here, you want to get that. Do some compression strokes, broaden out this. Then you're going to come and you're going to petrissage. Get a little bit of this knee. This is the popliteal, and it's a contraindication. Never apply a lot of pressure right here, but don't go whoop and then skip it. It feels left out. You always want to just lighten your touch in this contraindicated area. So I'm going to petrissage in here. Feel what's going on with. There's the pressure already. Feel what's going on in here. And then I want to get down a little of that foot right in here. Your goal to me is to be able to come in here without them flinching, because this is a nerve, just like here in the deltoid. You'll find all this stuff, and all these nerves are coming through here, so you don't want to hit this area and go deep on it. You want to come around it. So coming in here, the gastrocnemius, and you can look at it on the chart, comes across here. You want to get in the middle and you want to spread that out. You know how you always see runners that are stretching this part, this tendon? That's why you want to work on this. Again, the retinaculum band comes across here. You may want to do some twists, come off of that foot. Get around that heel, get in here. Be gentle with this, but make sure that you're feeling what's going on. And then you come in here. So I've petrissaged, I've compressed, I've splayed, I've petrissaged, and then I'm coming here and saying goodbye to this whole area. You don't have, it's easy, easy, easy. I barely lift her leg. Pull the sheet out and she's covered up. Now when you do the glutes, I'm going to pull this down this way. You want to find where the sacrum is. And that's this bone right in here. And so you want to kind of feel what's happening there. You just want to kind of fall off the side of it and start feeling what's going on. So as you're looking at this, you have your cervical, 7 cervical vertebrae, the thoracic, the lumbar, and then now we're coming into this glute area. You can see all of these muscles. They're called the deep 6. If these get shortened, then they're going to stop any rotation from happening in this trochanter, in this big ball in the bone here that fits into the hip, as you can well see. If this isn't moving properly, then what's going to happen? Then the hip is going to try and move because this doesn't move, and their range of motion is limited. Well, as you see these, swelling can come out of this sacrum. No nerves, these are your nerves. No nerves are going to come out of the sacrum. However, you can feel, and you can just barely palpate them, and you can tell that there's some swelling going on in here. You want that swelling, so you're going to see me swell this or work with this swelling. And then when I do loose fist, I'm going to be trying to push and work all of these muscles. What you will see when I do this, what you're going to be seeing, it's kind of like superficial. You're going to see me doing this, but you just saw all those muscles that came and connected in here, and you saw the nerve problems. So my hand is right here, and I'm going to kind of feel for any swelling. Pressure's still okay? I'm gonna kind of feel for any swelling, and this is done gently. This is just like a rocking. If you'll always rock from the superior to the inferior part, that's where the blood is gonna flow out. It's not gonna flow here, it's gonna flow down here. So, you know, kind of rock it, and then where the sacrum and the bone is, I'm gonna fall off of this bone, and I'm gonna come in here. Now, if you push on this real hard, it's electric. All these nerves we're talking about now. When a client talks to you, they have the terminology you want to give them, trying to find out what's going on. And I'll say, does it throb all the time? Does it ache all the time? Is it an electric? And as soon as they say it's kind of like an electric shock, you know that you're dealing with a nerve, a neurological problem. And when you're working with the nerve especially, you don't want to just dig into that. So this is gently, this is a sawing. And I'm all along this bone, feeling up to the hip of the bone, up in here, where you put your hands, the iliac crest is what it's called. I'm feeling all the way up into here and coming down. This is a perfect time, and modest people can feel comfortable with this, where you come to that sit bone that I showed you on the chart, where the bone comes. The muscles get real tight in here, so sometimes I'll just do a little rocking cross fiber friction in here, and then come up on into here. You always work lateral to medial. If they had a sciatic or one of their glute nerves coming out here, and I started doing this, I could cause more problems to that nerve. So both stance, lean in here. If you just do the warrior stance, you go kind of more down, and you don't get as thorough of a stretch in that trochanter area. So coming in here, you can see my thumbs are really on top of the trochanter attachments. I'm just getting right on those and coming into here. And I'm finished with that. Now this is a demo. Y'all will be feeling and doing a lot more than I do. My transition is I want her to know where I'm going. I don't just all of a sudden my hand walk around for a while. If you're on hold on the phone for a minute, it's forever. A minute can pass without you touching your client, and they're gonna feel like it's a forever thing. So then I walk over, they know where I am, I come up here, and then the correct way is starting with the glutes. That's the Swedish routine here. That's just what we teach at school. Again, I don't want cookie cutter massage therapists. I want intent and you guys knowing what you're doing. So I come in here and I assess what's going on. Feel for any swelling. Got some little something happening right here on you. Can you feel this? So I'm feeling like there's a lot of tight stuff happening here. I'm going to address that a little bit longer. See if I can't work it just some. Then I'm going to come. As a matter of fact, her left side is far more compromised, far tighter than the right side. So now I'm going to come in here gently and see what's happening. Come back and forth. Find out what's going on in here. Maybe do some cross friction right in here. You don't want to go anywhere past about the middle because you can reach that muscle coming sideways here. You don't want to come at it in any other direction. You want to just kind of come into that side, work that around. Now you can see my thumbs are on the trochanter. My thumbs are circling. If y'all will all really, this is a very important part of the glutes. So here's this big bone that fits into the hip. And so I'm using my thumbs and I'm working around it. And then I'm going to come from lateral. I'm going to work my way in medial with the glutes. And there are a million, if not more, plus a million plus every single one of y'all in here that will be doing it your style. Always though working lateral to medial. And we're going to address this a whole lot more. That hurt right there, didn't it? Okay. So she definitely has something. I can only guess a SI joint. There's so many things that it could be, but something going on right in here. So I'm going to go ahead and drape her back. And then I'm going to drape the leg. Remember, get all the sheet out of the way till we're dealing with the edge. If I look at her, I know what hand to use. If I do it this way, then see how I'm gonna have to start tweaking my back and everything to come around here just so that I can pull it tight enough. So if I look at her, I know I'm gonna lift here. Be careful not to hyperextend a knee. You don't wanna lift it up here. You wanna lift it about here, because if a person has a knee problem going on or a pathology in their knee, you don't want to make that worse. So I lift up here, grab about where the bolster is, and then I'm going to pull and tuck, pull and tuck. Again, I'm working the whole area. I want her to know where I am. I want to say hello to this area. And we're going fast. This is a demo, guys. I want y'all paying a lot of attention to all the muscles. There's 1, 2, 3, 4, 5, 7, 15, 18. It feels so good. They want you to keep doing it. I've said hello to the area, said hello to the foot. Now I'm going to come up into here. I'm going to petrissage the inside. If the sheet, it's tight up here, but you can see this. If a sheet ever starts getting in your way, you don't want to redrape. Take the time to do all that. I'm working in here and feel what's going on, but say that sheet falls here. I can just keep tucking it. Did you see how I could just keep tucking this sheet in and working with it? So petrissage, but feeling, it's not just picking stuff up, it's feeling. Sometimes you may want to grab a hold and then run your fingers across so you can go, ooh, I feel a muscle there, a big one there. Boy, that fell in, now this. So that's part of the petrissaging, is you're picking up, feeling each of these individual muscles and what's going on with them. Going on, I can feel this one, and that one's really tight, and this one. So there's a petrissage on that lateral side, a petrissage in here, medial, lateral, effleurage that out. A lot of times you'll hear sun and moon. All that is like a sun would be around, but you have another hand working around that hand. That would kind of be the moon. So that's basically the sun and the moon stroke. Now I'm going to do a wave. There's loose fist ironing. Can you put Pandora on? Loose fist ironing. Saying goodbye to the area. Getting around that trochanter really good. Circle it one way, then the other. Muscles just don't go one way. Then I'm coming in, petrissage. Ring around that retinaculum band. Petrissage over here, see what's going on. Right in there's a really tight muscle. I like to just zero in on that. Sometimes, and we'll learn so many more details, but I'll come in here and go, I didn't loosen that quite up enough, and I may decide to go on up and come down in. We want to be sure and get around this malleosus. Get in here in the foot. And that gastrocnemius, can be so tight. And this is, I can't tell you how basic this is. This is like the most basic. You're more than anything just learning how to work on the body a little. Come in here. Splay that. Splay in between where these are. Not pushing on the popliteal. Can you see how I'm kind of picking up with my whole hand what's going on in here? Effleurage my way out of here. Are you guys realizing how simple actually it is? Because it's just redundant again and again. Don't give me that fearful look. You don't, again, I don't want to cross over. I bring this up, and if don't bring it, you can bring it straight down and it's still going to come here. But always protect your client, especially in class. When you're not in class, there's no one like over here to see you. So now we assessed where the sacrum was, which was right here. you want to fold the blanket down. And then you want to bring this down to about where that sacrum is. If they have, like, she's got a little band here, I see. So what I'm going to do is I'm going to just tuck this in a little bit. Remember, if you hold that bottom sheet, this tucks beautifully. So then I'm going to tuck this in, pull the arm out a little, hold that, get the blanket out of the way, or the tuck can come loose when you use the blanket, and tuck this in. Now the assessment, the reason we say no lotion on the assessment is because when you have a lot of lotion, let me get this all out of the way. When you have a lot of lotion on your hand, you're going to realize that you do more sliding. You don't have like a good grip. So as I assess her back, and this is kind of myofascial work, if you will. As I assess her back, you have the spine. So here's the spinous process, where you have your cervical, your thoracic, your lumbar, into the sacrum. Right off of those are the transverse processes. And I want to fall right down in the middle here. So I'm going to assess just by kind of, if you will, kind of hooking in. I'm in the bow stance. I'm not like this. It's important, bow stance. And if anybody over there that can write, Tracy, if you see something that you could write that will make sense, so assess, however, for number, that would, yeah, assess the whole back. But look at how much color I got there just leaning into her. So I'm pushing here, and then I'm going to just feel all in this groove. Like I can feel right here something going on with some vertebrae. I'm going to remember that. And then I'm just going to be feeling. You cannot whiz over it and feel what's going on. I can see already the difference in this. If y'all will come even to the head of the table, you're going to see what I mean by I'm assessing her. And there's a big difference between, see how this comes way in and this doesn't? Just kind of take a second to look at that. You can see, do you see what I mean?
Yeah.
On assessing it? The best way is right in the front, and you can see a big difference in that. And you'll learn to spot these things very fast. I can see that this dips in, this doesn't. This goes straight, this comes out. Feels like something's going on in here, as well as I found some stuff in her sacrum. All these things, your intent is in that, and you start realizing, I need to work on that. That's one of the things going on. So I've hooked in here, and I'm assessing this back on what's happening with her. I get to this sacrum, and I want to just give it a nice push. If you look in the direction you want it to go, it'll keep you from pushing down on it and giving it a better stretch. So I'm kind of assessing now the shoulders, what's happening in here, what's going on in here. I'll come along and assess this traction. If I don't come down and think again like straight, I don't stretch it properly. So I'm here and I'm just doing it. How does that feel to you?
That's good.
So it's just a good stretch on that occipital ridge that I've got going. And then I'm going to start the routine. I want her to know where I am, and so I'm going to say hello to the whole back. So it's like hello, and you come across the hips, up on that waist, across those shoulders, up into this neck. Do not forget that neck. Get a little teeny bit more lotion. I'm a person that doesn't like to work with a whole lot of lotion. I feel like it prevents me from feeling what's going on in them. Coming down this arm. So now on the right side, on the whatever side, then I'm going to go in this groove, and I'm going to come down along that rectospinae, off of the hip. Do not stop here and leave all those toxins right here over the kidneys. Come off of them. Come here, come off. I'm going to come now that, you know, you have the rectospinae, the longissimus, the iliocostilus, the trapezius. We'll go on and on and on with muscles that you're going to be learning. I'm gonna come down here my third time. Did you see my transition? I didn't come here 3 times and like I'm roping a calf or something and let go and okay. I came, I had my transition, stayed with her. Now I'm gonna come back up 3 times. As I come up, I like to bring my shoulder off and just, you'll do the elbow, but I still feel like, or you can come in here with your hand if you felt a lot of neck problems. Look how wonderful this could feel to them. I don't want to make them trying to hurry. I don't want to make this too long. Coming up again, up in here. And then I believe on the routine it's going to tell us we need to get this shoulder area. So you lay the arm off. I want to get the deltoid, the tricep, and work in this area. So I'm here. I want to petrissage this deltoid, get up into that neck. These will come natural to you. You're going to be here petrissaging, and then you're going to petrissage this tricep, effleurage it up in, cross that shoulder blade. Effleurage it up in, cross that shoulder blade. Then we'll
Drop the arm down?
Yeah. So then I'm effleuraging.
All the way down.
And remember what I said about always make it a full stroke. Never just, you know, you don't want to do that. You want to come in here and come off of the body like where the table is. So after I've gotten this, now I want to find out what's happening with this, with the shoulder blade, with the scapula. I'm going to lift her hand up, and when I come underneath her shoulder, you can see how she's a real, not used to receiving, like so many of y'all. I'm telling you, once you have learned to receive, you're going to give a much better massage. Right now, I mean, we're all givers in here. This is a good class for that. But so you can see when I lift this up, some people, you're going to ask, can you put your arm on your back? And she can hardly do that because this is all so tight in here. Some people, I could slide more than half of my hand under their scapula. Some people, I can't even find the scapula, and so I know I'm working on these rhomboids in here. So go ahead and relax. I think that would hurt her more than not. There are other ways to do this. I can take and I can roll her arm up if she'll let me. And she's not, so what not a chance. The elbow's still bent. We're like, not happening. Just relax. This is the cool thing about learning to do this. I mean, I wouldn't let somebody jump in me and handle and film and everything else. Me, I'd be going like, I am under the table, and when y'all are done, let me know, I'll come out. So, you know, this is a really difficult position. And then here she is so tight across this entire shoulder girdle. It's just. So I'm going to gently start rocking. I have a lot of time for this in that 50 minutes. But if I will just push up on that shoulder blade and rock, I'm even going to drop her hand for a minute and come at it this way. Because I need to feel that scapula. I need to feel what's going on in here. These attachments are just like the attachments that you learned when you were doing the front of the body. Coming up again. Now, instead of trying to pick her up or anything, I'm just going to push and do the best I can around this scapula. I'm going to come in here, come off, drag my arm back around, come in here, go up the neck a little, get in that trapezius area. Come in here. Now you see I'm finally getting some color. Is this pressure okay for you? I'm finally getting a little bit of color in here. I'm going to do the tricep this way for a minute. And then I'm going to do a little sneaky trick I'll show y'all that may not necessarily be in the routine. But if I come in here and I'm just working the tricep and coming up under here, can you see now how I can move that? I just approached it from more of an anterior way. And you can see I can move this scapula that way, whereas in this basic routine you learn you can't. So I can come in here and start, wow, that needs that so bad. Whew. It's hard to just move on, guys, and be, you know, try and say, okay, that's that, and we go, when I could spend another 45 minutes really working on her in here. So then you're going to go with your elbow down. Do not cross this spine. I will fail you when you come to the routine to go into clinic. You can knock a vertebrae out. You don't know yet. There could be, you know, slip discs. There could be a lot of things going on in. So do not let me see you cross that, and do not let me see you just stop here. I want to see you flow off, bring it back. Go down, flow off, bring it back. Go down, flow off, bring it back. Come down, and then it's the same. You did 3 down, you did 3 up with your hands. Now you do 3 down, and you're coming 3. You're just, believe it or not, you work the different muscles as well as the muscles that you have worked differently. 3 times up. Now what I want to do is get into the lumbar. I've worked the sacrum. I've continued to kind of work what's going on in the neck and the shoulders. I want to get this lumbar, this low back problem taken care of. So I'm going to be using just a little bit of lotion, coming around the hip and up into the diaphragm. You're going to learn to do bony prominent checks. Like I can go right here and go, okay, here's this rib, here's this one. What does that tell me? There's a lot off in that going on in there. So if this were my client in my assessment, I would lay her on her side and stretch this out an awful lot on our next appointment. The hard thing about the first appointment is how much you assess and learn, and it's too late to get in there and do it. So again, my body, I'm not doing this. I'm not killing my shoulders. It's not all about my shoulders and my neck. My body is going to swing around the bottom of the diaphragm, the bottom rib. I'm going to come here, swing into this area. And then it's kind of more like it really is. You don't just pull. See how I'm pushing and then pulling and then pushing and then pulling. These are tight muscles in here. Get a bit of a petrissage going on in there. Bit maybe of a stretch here, and then I'm going to work these traps, and this is going to come into here. As I switch sides, I want to just be sure and go, okay, one more time on the neck up into C7, and then I start my routine, dragging it back. 2 rectus spinae muscles in the groove of that spine. 3, as I do 3, I walk myself down. 1. Do you see how I'm coming in here and getting that neck in that trap? 2. 3. And it's not engraved in granite. I stayed in that groove, but I also have all of the obliques. I have all of these other muscles, diaphragm muscles, getting in here in between those ribs in the intercostals. And then I'm going to take, drop her arm, and I'm going to petrissage, picking it up, working it, petrissage, proximal to distal. I want to, and especially when you learn lymphatic, you're going to learn the importance of getting into this auxiliary or armpit area, if you will. So I'm up here, I want to empty fluids. I want to petrissage all these attachments that are in here. Effleurage. Effleurage into that neck. Put the arm on the table. Lift it up, come under that scapula. This is going to say saw. You can do it this way. And again, like I said, some people I could take half my hand and put it underneath their scapula. I can't get a finger under hers. She works too hard on the muscles. I want to kind of get all these attachments and what's going on with that anterior serratus. And even as I assess her arms, this elbow's way up. This one is a lot looser even now than this one. And she corrects them the second I say it. We all do. Not she. We all do that. You know, if someone said, you're standing crooked, I would immediately be like this. Hi, Hubby. I would be up like this. Now I want to come up into here some and just see if I can't get some movement. See how I can lift that scapula, that whole scapula. See, I'm getting a lot more. Is the pressure okay? This is a tender spot. This is a hard spot to get on anybody. And then I'm coming back underneath that scapula. And then don't forget that then we do the elbow down and around and back up. Down, around, back up. Now I'm here, I just shift off. Elbow. You see how I'm including this pelvic girdle in that so I don't leave all the toxins right over these kidneys. And then I want to be sure I've done the glutes again. I've done here, and I've caught up in here. And this side's really tight. When we assessed and we were looking at, I saw a lot of that. So I want to, these ribs were so different. If you'll just splay your fingers just a little teeny bit, you can get in between the ribs. See, I can come all the way down around and be in between these ribs. These fingers are working the tissue, the connective tissue on the tops of the ribs. They're lighter right now. These are going a little bit deeper. I want to move that rib down some, so I'm more focused getting into here. I'm going to come down, swing my body up. This is not this with my body. My body is just so grounded and in tune with what hers is telling me to do. This isn't me. This is her body's blueprint telling me what to do. Swinging in, coming back. And then you want to say goodbye to the body, and you'll have your signature stroke for goodbye. Your signature stroke is kind of like they feel you here. You may want to pull up. I would suggest, because they're a little tense, you've hit some hot spots. You've kind of hurt some places. Remember, if they haven't had a massage, especially like a medical or a deep massage, so I'm saying goodbye. I'm coming up over those hips, gently, like a thank you, body, that you gave us what relaxation and what help you could. Coming off, a little tug on the neck. Then I pull the sheet up. And I pull the blanket up. And at this point in the transition, I like to say goodbye. This is my moment of prayer. Thank you. It's just like that he was saying, the universe, thank you, Lord, thank you. However, this is where I'm tapping into all of it and saying, may the very best and honorable thing have been done for her body today, and may she feel it and know that she did it herself. It's just something that you'll end with in your own mind, whereas you want to tell them, be real careful getting up. You could get dizzy. We've pushed a lot of toxins and blood and oxygen and fluids around, or however comes natural for you to say it's over. I like to say goodbye. And I always feel like, again, wipe those feet. There's something about saying, oh, to the feet. It's like, oh, it all got done. Get this out of the way. Hold this. Lift it up. And take the bolster out. Always you want to put your bolster or anything underneath sheets. You don't want the actual vinyl, leather, whatever type tables you have. You don't want that actually touching the client. And then there's transition ways that I didn't show you yet on how to have people turn over. And if say that she wanted to turn over, I would tell her, if you will please just turn towards me and roll onto your back. I'm having her turn towards me because I can control this in a classroom environment, and just scoot down on the table. And she's very modest, so, you know, she's grabbing it too. It's like, oh, and you just go ahead and scoot down on the table. Let me get this out from underneath it. Normally, they won't be grabbing this. Now I'm going to have you one more time, if you please, will roll away from me and scoot up on the table. Keep their shoulders and stuff covered. Just go ahead and lay on your tummy. And you want to keep everything covered, and especially with women. You don't, guys just kind of roll over sometimes faster than you can know what to do. But with a woman, if we roll over real quick or something, we need a little bit more protection. So you want to always kind of be making sure, won't matter, I'm sure if their feet get a little air, they'll live with that, probably enjoy it, but not up here. So you really want to protect this. And if I was going to work on her, of course, my next step would be to take the sheet, get it out of the way, grab this, hold it, just have her lift her legs. This comes underneath. Go ahead and lay your feet down. The important thing is that you check with them. Is this comfortable? Yep. So right there's perfect. You lay this down. If I were starting the routine, I'd be coming over here, moving the blanket out of the way, starting on the glutes, then going to the leg. I would replace it. I would come over here, move the blanket out of the way, do the glutes, then drape and do the leg. And then you know how to check for the sacrum. You know, first you pull the blanket down to get it out of the way, and then I won't have her re-drape and everything again, but then you would drape and then you would assess. Thank you so much.